Welcome back to America Decides. The Trump administration's foreign aid freeze happening as a deadly Ebola outbreak spreads in Uganda. The virus has killed one person and infected at least 8 others. Some health officials in the U.S. are expressing concern that with USAID and its future in limbo, this could perhaps get worse. The aid pause has already led to an understaffed contact tracing and screening of departing travelers from Uganda. Dr. Craig Spencer joins us now. He's an emergency medicine physician and an associate professor at Brown University, their School of Public Health. He's also a survivor of Ebola. Thanks for being here. You have worked to combat infectious diseases here and globally. What does this mean as we watch this outbreak, and does USAID and the disruptions in Washington matter or not, in your view?
Well, I think you gave a good summary. We're at about 9 cases, and this outbreak was first announced a couple of weeks ago. It appears that right now this is under control, but that's because the Ugandan Ministry of Health has really great, capable people, and because the World Health Organization stepped up and did a lot of the things that the United States generally would support and fund. Let me tell you what would normally happen and then what happened here and why that concerns me. Normally, you would have, within a few hours of an outbreak being reported, the CDC mobilizing teams to go and respond on the ground. Some of the best viral hemorrhagic fevers in the world are doctors and people in the world are in Atlanta. That did not happen this time around. You would have USAID help mobilize support to set up border screening at the airport in Kampala, a very big airport in Entebbe that has links all over the world. That did not happen. The USAID support did not materialize. That was done by WHO. So others have stepped up as we've retreated. The problem is that how long are they going to be able to do that for? There's also an outbreak of Marburg virus in neighboring Tanzania, which is very similar to Ebola without any treatments or vaccines. There's Mpox, which is currently circulating next door in DR Congo. And just 2 days ago, there was a report of a new variant here in New York State. So not having USAID, not having CDC, and not being able to even talk to our partners at the World Health Organization is making us a lot more vulnerable, and it's going to make it a lot harder to end these outbreaks where they are before they can spread further.
What happens now in places like Uganda? What are they on edge about, if anything?
Well, Uganda is dealing with more than just Ebola. It also had support from PEPFAR, the President's Emergency Plan for AIDS Relief, which for the past 22 years, since started by George Bush, has been providing medication for HIV and helping drive down new cases and stabilizing cases of HIV all over the world. One of the most successful global health programs ever, has saved 25 million people to date. But I know right now friends of my own that were working on that program in Uganda, in Rwanda, in Burundi, who had to let staff go because the money overnight just disappeared. It wasn't able to be distributed because around 10 days ago, Elon Musk said they're going to throw USAID into the wood chipper. The impact was immediate. It's not just Ebola, it's not just HIV, but it's our eyes and ears in Uganda, in Rwanda, in many other countries. In the past, we have those relationships. We would know what was happening as soon as things develop. Right now, we're not even having those conversations. We're not in the room where those things are being discussed. And because of that, we have no transparency. We're not able to prepare here. And because of that, that makes us a lot more at risk. And it makes it a lot harder to address these threats where they are in places with the people that we've worked with for a really, really long time.
A judge, as you know, blocked the Trump administration from cutting medical research this week. So what is the impact of that, if that actually holds?
Yeah, so the proposal was to cut the indirect rates for NIH funding, which goes out and supports the best biomedical science in the world. If you look at the places around the globe that do the most cutting edge research in medicine and in health, they're mostly right here in the United States because the NIH supports them and then provides indirect costs to make sure that we're able to hire people, keep the lights on, make sure that we're able to hire staff. And the proposal is going to cut a lot of that. Some institutions will lose tens or hundreds of millions of dollars. Talking to my friends that are responsible for leading many of these institutions, they've said to me, I'm going to have to fire a lot of people. I'm going to have to stop a lot of the work that we're doing on things like cancer research, on things like trying to find, new treatments and therapies for diseases that have been underway for quite some time. And tying it all back, there is now Ebola treatments and Ebola vaccines that didn't exist 10 years ago when I was working in West Africa. We have them now because NIH funded and supported work. If we cut that research off right now, we are going to be cutting off access to future treatments for other diseases that we don't have treatments for. That will make people less safe in those outbreaks in Uganda and elsewhere, but it'll also mean that if those things come here, we're not going to have access to them because they don't exist, because we're no longer investing in them.
Dr. Craig Spencer, thank you.
Thank you.